Hey, everybody. Welcome to Dentistry Beyond the Numbers. My name is Dr. Marc Liechtung. Thank you so much for joining me today on this continuous ride on trying to really figure out our wonderful, wonderful profession. Today is an action-packed podcast. It's been a question that I've been asked many, many times. They'd say, Doc, when's the right time for me to bring in an associate? I'm 35, I'm 55, and I'm 65. When do I do it? When's the right time? What type of an associate? So today I want to address a few different stages in our careers and what would be the optimal time for us to bring in an associate. What type of an associate? Does the associate just do fillings? Do I want them to take away from my revenue? How do I incorporate them with my staff? Do I have to overlook their shoulder and make sure their crown preps are right? Do I have to call the lab? Make sure the margins on the impressions are perfect. This is what we're going to talk about today. So let's get started, everybody. I'm so excited. This is probably one of the more important aspects to growing a practice. You know, us dentists, we have two hands. We can do as much as we can in our operatories, but ultimately we are limited. By bringing in an associate, we expand our ability to perform dentistry in our practice. We are assuming, first of all, in all cases we're talking about today, that we have enough operatory space to bring on an associate. So let's give that a given. Whether we're 3 chairs, 4 chairs, 8 chairs, we have enough chairs to bring on an associate. I want to address today, like I said in my intro, to narrowing it down to 3 different categories, because I think those categories seem to depict exactly what I'm looking for and what we're looking for when we go to hire an associate. Let me tell you what I'm talking about. Let me give you an example as we get started. First would be, if I'm a 35, 34, 38-year-old doctor in the onset of my career of owning a practice, a beautiful practice, wonderful location, beautiful windows, great waiting room, and I'm doing great. I have the space and the patients are coming that I want to expand. I want to grow, and I want to really hit the mark, hit the ball out of the park with my practice. But like I said, you know, the doctor knows that in order to increase procedures, they have to increase doctor schedule. So they decide at that stage in their career, they're bringing on an associate. What type of associate? Am I bringing on an associate that, you know, does what I do? At 35 years old, young doc building a great practice, he or she is looking for somebody almost their equal. They are looking to get production, grow hours, have 2 people that corroborate in cases. Somebody would say bring on a specialist. But if you remember Dentistry Beyond the Numbers, when we talked about financial explanations, a specialist in today's world on a premolar or molar root canal gets 50% or more on what they're doing with those specialty procedures. An associate gets 28, 30, 32% and grow from there. Number one, somebody would say, well, it's not as good. Today, we're taking that these doctors are trained and proficient in these procedures. So if I'm a younger doc growing my practice, I want somebody who can give me evening hours, morning hours, somebody who can give me the 3-4 days a week that I have an overage of hygiene patients. Let's say I have 2 hygienists that day. I want to start my practice with 2 doctors and we'll grow from there. It also gives me the ability to treatment plan with another doctor. I always feel that dentistry is phenomenal when you practice with somebody or with a group. You could corroborate and really evaluate different treatment plans that come along. A young doctor, you'll add hours and we'll add procedures. Because if I'm a doctor, like I was when I practiced, and when I'm practiced, I like doing restorative, cosmetic, some minor surgery, but I was big into crown and bridge. My first associate, my main associate was somebody who was able to do root canals proficiently, extractions and bone grafts, things that I would hesitate or refer. That person was able to capture some of the patients. So it worked out. 10 years later, he's a mainstay in the practice. and procedurally, he's excellent. So I think the ability for a young doc to bring on almost a partner-esque, but an associate, increases revenue. Now let's look at the doctor who's been in practice for 15 to 25 years, somewhere in the neighborhood of the mid 40s to the early 50s. They've been having really great years, producing fabulous amount of dentistry quality. But they say, I'm getting on. I want to position myself that I don't have to work 2 Saturdays a month, or I don't have to work 5 days a week. I want to bring in an associate at this stage that I could slow down a little bit so I could prolong my career. By not working every Friday or Saturday, I give myself a 4-day work week and I bring on an associate. But here's the problem. You see, I find that doctors don't want to give up the revenue. If Mary, the patient, comes to see me, she needs 3 crowns, a couple of extractions, 2 implants, and 2 crowns. I say, wow, that's phenomenal. If I have an associate that could do those or most of those procedures in office while I'm doing other procedures, I'm increasing the revenue of the practice for the next 10, 15 years of my practicing to let me have or position my practice to really being amazing, to be able to sell it or to be able to transfer it, or really just have the ability to bring on associates that will allow me to keep practicing for as long as I want. So the middle-aged doctor is looking for somebody who's really bringing on procedures that I may have referred out, shied away from, looked for a specialist to come in. But now I have an associate who's been trained in root canal, does extractions and bone grafts, and I've never done Invisalign, or I do very few of them. Now I'm bringing on somebody who's going to really be proficient and has really spent a lot of time studying and learning and doing a lot of clear aligner cases. So we have to evaluate our practice, see what kind of associate would fit into my procedures that I may be deficient or not doing. And that will allow that associate to gain a better book of business, be busier quicker by seeing patients that I may not see. So I'm not losing revenue in my hands. I'm actually gaining revenue because I'll have the ability to do things I really enjoy, do it proficiently and do it well. While I'm in the other room, I have an associate that I like very much doing things that he or she are very proficient in. So now I've got double guns blazing. And it's phenomenal because the next stage would be an exit. So if you understand, we have the early type of doctor that's looking for that, really somebody who's equal with them. Maybe they're a little bit ahead, but this is somebody who's going to add continuous revenue and continuous quality to grow the practice. The second one so far is somebody that is looking to grow procedures, grow revenue, allow the doctor to take a little time. So family is big in those ages as we hit our 40s. They're older. We want to spend more time. Maybe we want to travel a little more, enjoy a little bit, a weekend that's maybe a 3-4 day weekend instead of a quick weekend. And yet the procedures that I was not doing, we have an associate that now can carry the ball doing those procedures as well as others. What happens? So it's really a big difference if you think about what kind of doctor we're looking for in those 2 different scenarios. The third aspect or the third scenario that I want to put forth today is that what happens if I'm 58 years old, 60 years old, I know about the groups, I know about transferring and my exit, but I'm a doc in a box. I'm a single doctor doing $2.5 million, killing myself with a great hygiene program. Now, big aspect. If you remember what we talked about when Dentistry Beyond the Numbers talked about EBITDA. EBITDA is formulated by taking all the things, the operational costs, but also calculating what it would cost to replace the owner doctor compensation. If I want to position myself, and I'm 56 years old, and I want to position myself for a sale, this associate might be totally different. First of all, I would look for somebody that could take a lot of the work away from me to allow for the next 2-3 years to be more balanced between doctor and associate. So ideally, I'd be looking for somebody who within 3, 4 months can step in and do some of the things or a lot of the things me as doctor owner would do. The second thing would be that I am looking for somebody who is here for the long run, whether I sell it or don't. And maybe that person might be interested in taking it over. So talking partnership could be a possibility, right? So these are different scenarios at different stages of our career. To me, they're all absolutely equal of importance. And I, being somebody who loves mentoring, I think at every stage, we have to be an owner, doctor, and mentor. Because in order for doctors to be successful, they need the tutelage of somebody ahead of them. They need to know that they could take those steps. They could do those procedures. They could take that little sort of gamble. You know, I often say to my docs that work with me, I often say that there's a cliff. And I use this analogy in dentistry. There's a cliff in Jamaica, in Negril Beach. It's called Cliff's Bar. And right outside the bar, there's a little bit of a diving platform that you dive about 2 floors down into the water. You walk up, you're feeling good. You just left the bar. You give all your faith to the gods and you jump in and land in the water. Dentistry, when you're starting out as an associate, and we will get into that down the road, is very much like that. You walk up to the cliff and you want to do 2 extractions, curette, and bone grafting. And that is the time you say to yourself, if not me, then who? You have a doctor owner in the other room, and that's so important. As an associate, you want to be able to jump off that cliff. As the doctor owner, you want to allow your associates to be able to feel confident enough to be able to jump off that cliff. If not, we will hire an associate, but yet we'll be continuously doing all the work. So how do we incorporate an associate into a practice? That's a whole nother level. Right now, what am I looking for? If I wake up Monday morning and I say, I'm 50 years old, I've got a fabulous practice, but I'm killing myself. Look for an associate that's for the long haul, that does some of the procedures you might not be doing or always thought that you should be doing more of. I'm not talking about night guards and sleep apnea. I'm talking about extraction, bone grafts, root canals, and clear aligners. I'm talking about things in my dental Hamsa that really elevate and really put the practice into another level. This is such an exciting topic and so intricate in when we grow our practices. What happens if we find the wrong associate? These are all questions I ask you. Have you ever gone through that? Have you ever staged yourself to find an associate, and after a week, you're looking at your staff and you're saying, this isn't going to work? What do I do? I don't want a revolving door. Great questions. These are questions that are asked every day in practices around the country. What we need to do is make sure we hire the right associate. Make sure you're getting somebody that is congenial with your team. Make sure somebody that comes in and respects our team. And then again, make sure you, the practice owner, can work with that doctor, can feel, I'm going to tell you a little secret about something about a New York guy. When I had a big practice on the West Side, I would be a little bit skittish about telling people straightforward and not wanting to hurt their feelings. Today, I feel like telling them straight up what's the problem not only helps them, but I find their feelings are better because they feel I'm honest and I'm really straightforward with what they need to do to learn and get better. It's so exciting when you bring on associates. I hope you look at this as some sort of a referral to what you need to do and when you need to do it, because it's really important to make sure that doctor fits properly. So it's been great. In review, when you're first starting out, you want somebody that's your equal, can grow together, give the hours. You don't want somebody who can't work on this day or comes late on that day. You want somebody that's going to give you what you need. And obviously, an excellent dentist to produce great dentistry to grow. Second one, somebody that looks towards the future. I'm 45, 52, 55, and I need somebody who's going to help me grow to the future. procedures that I might not be doing and procedures that I might want to teach. And that person will grow to being a real cog in our wheel, a real force in our practice. And who knows where the future brings them. The third, you're setting yourself up for an exit. There's nothing wrong with that. Find the right associate. Let them start producing. That might require somebody with a little more experience, maybe somebody who has a nucleus in town and brings with them maybe 200-300 patients. But whatever it is, you need to be able to let go a little sooner than if that dentist was a young dentist back in my 30s. I hope you understand it. I think it's a great topic to discuss. And I want to thank you all for listening to me today. Again, this is Dentistry Beyond the Numbers. And I want to say, if you like it, share it, please. I would love to know topics that you're interested in. There are so many topics to discuss. And remember, like us on LinkedIn, Instagram, Facebook, and any other social media platforms you see me on. This is great. I love talking dentistry. I love talking dentistry beyond the numbers. Thank you very much. My name is Dr. Marc Liechtung. I will see you on the other side. All the best. Thank you so much.